There we go. Okay. Where do they come from? This is always such a huge question. People always want to know where their anxiety, depression, any other sort of mental health issue, where does it come from? And I always tell people it's a combination of things. Almost always, it is a combination of your biology and your environment. It's never just one or the other. Of course, there are certain things that can make it worse, or it might be more biology than your environment, or more environment than your biology, but there's no way to truly know that, and ultimately, it's probably a combination of both. So first we'll talk about the biological factors. So genetics. So we know from research that anybody in your family that has experienced anxiety and depression or has a mental health diagnosis, it increases your chances of also having a mental health diagnosis or struggling with those same things. We also know actually that now, this is really cool, they've done quite a bit of research on trauma, and we've talked about how trauma impacts the body and gets stored in the body. Well, it turns out that actually when you experience trauma, it gets imprinted into some of your genes, and those things can actually get passed down to your children. So literally, you can inherit trauma, and it's not that you're gonna, be born and be like traumatized from birth, but that might increase your propensity for having anxiety or depression, or might increase your level of sensitivity. So just something to keep in mind. Another biological factor would be chemical imbalances. That's what we know about, depression. What's happening is that the neurotransmitters, which basically send messages across the brain, there's usually a deficiency in one or more types when you have depression. With anxiety, it could be a number of different things. It could be chemical imbalances, but it also could be just a sensitivity to the environment as well. The environmental factors would be chronic stress. So we talked about chronic stress. That could be even a little t type of trauma. So stress that you've been feeling for time and time again, over and over and over again, will put your body into a state of maybe shock. It also will decrease your immune system response. Because again, we talked about when you're under stress for a long time, what ends up happening is that your body is trying to be in survival mode and take care of the basics. And so it's really hard for your body to be under that kind of pressure for a long time. And so that can create more anxiety, more depression when you are chronically stressed. We've already talked about trauma, so I'll just leave that as it is. Any major life transition can cause anxiety and depression. We talked about how even moving can be a significant source of trauma for people. And then, of course, absorbing anxiety. And so anxiety, we talked about well, not here, but before I've talked about how it's really easy to absorb anxiety from your environment. If you've been around somebody who feels anxious, you can feel it. It's sort of a restlessness, sort of a discomfort. You can feel like something is off. And that's because, again, God created us for connection, so he actually created parts of our brains that absorb what is in front of us. And so it's very easy to absorb anxiety. During COVID, there's been, of course, added mental health stress. So unfortunately, with all the research they've done on mental health after COVID, we find that there's been an increase in substance abuse, an increase in mental health diagnoses in individuals who did not previously have a mental health diagnosis. So people who have not struggled with anxiety or depression on a clinical level before, after COVID, are now starting to experience that more frequently. There's also some really interesting research, and I say interesting, also hard to hear, is that there's been a connection between actually having COVID and a neurological response. And so actually they're noticing that people who have actually had COVID, been infected with COVID, are 2 times as likely to develop a mood or anxiety disorder for the first time after they've experienced it. So if you have noticed, and there's even some research on people having psychotic episodes, and that's because they think that the virus actually affects our neurology in some way. Very, very interesting and bizarre and hard to hear. But I say all this just to normalize what it might feel like to be in a time where we're kind of on the tail end of COVID, but we're still really in it. That whatever you're feeling, whether it's anxiety, depression, or even some bizarre emotions or bizarre sensations that you haven't felt before, it makes sense that you might be experiencing these things, and you are absolutely not alone in that. All right, so what is anxiety? Well, actually, let me go this way. If you all tell me, if you say someone has anxiety, what do you think of? What is anxiety if someone were to ask you? You can just throw out some words. Panic attacks, possibly, yep. Restlessness, mood swings, for sure. Overthinking, over worrying. Yeah, all of those things are true, and we'll go over some more of them later. But these are the big ones that people say: concern, lack of peace, feeling unsettled or restless, somebody said, worry, fear, uncertainty, or a need for control. We'll talk about some statistics. So the Anxiety and Depression Association of America says that 18.1% of the American population suffers from anxiety disorders annually. That's a huge number, 18%. That's really big. Only 36.9% of those suffering will get help, even though anxiety is highly treatable. That's big. Okay? So what I always say about anxiety is that it's more than just a feeling. It is actually the brain's response to a lack of security and safety. It's a stress reaction. And so whether or not there's actually a threat isn't really relevant. The brain is responding as if there's a threat. There's not always a clear trigger. And so the types of anxiety you can see there's even more diagnoses for anxiety, but these are some of the more common ones that we see. Generalized anxiety disorder is excessive worry for more days than not. And this affects 5 to 6% of the population, and it's twice as likely to happen in women. Generalized anxiety disorder, this is when you can explain that there's not one specific trigger. What's interesting about generalized anxiety disorder is your anxiety can kind of hop from one thing to another. It finds things to latch onto because it's wanting a sense of control. And so there may not be one specific thing somebody is worried about. It may just be that they're unsettled and they just have this feeling of being concerned and kind of this heaviness, but also agitation all at the same time. And so that's for generally for more days than not in a month's time. Panic disorder, you mentioned panic attacks. Panic disorder means that you have had recurring panic attacks, and then generally afterwards, after you have a panic attack, you may have a month of worrying about having another panic attack. It feels like crazy making because you don't want to have a panic attack. You're afraid you're going to have it. It's very stressful, very, very stressful. But this affects 2.7% of the population in the United States. Social anxiety disorder, this one's really common. We see it a lot for kids as well. Kids and teens struggle with social anxiety disorder, about 6.8% of the population. These are people who feel anxious when they enter into new social situations or large groups of people. It could look different ways for different people, but typically they will avoid people whenever they can. Another one that I did not put on here, was obsessive compulsive disorder. And so this is a tough one, and actually the prediction is that over time there will actually be more OCD diagnoses after COVID than other anxiety disorders, which makes sense with all the hand washing and with all the concern about germs. So obsessive compulsive disorder, you get a thought in your brain, something's wrong, okay, I am going to get sick. And then the compulsion, in order to fix that thought or relieve that thought, I have to do something about it. So I need to wash my hands over and over again, or I need to count to a certain number. Typically, the compulsions are fairly irrational. Not to say, they don't actually fix the problem, because the problem is the thought, not necessarily the threat, if that makes sense. And so that's a big one. Yes, you were going to say, you have your hand. Yeah.
Sky high because like our 2-year-old class even this year had such a hard time adjusting.
Yeah.
I mean, worse than ever before. And I've been here for 34 years. And I think it's because we're dealing with the COVID generation. Those kids have been home for 2 years.
That's right. Yeah, and so that's a new challenge that they're having to face, is getting kids back into, and getting anybody back into the world. Even adults are kind of having to adjust to a new way of being in community because they've been separated from community so long. Also, this is just an additional thought. It's really easy for people to have gotten used to being isolated and not interacting with other people, that going back into the world can take a lot of effort and can cause a lot of anxiety, or I don't remember how to do this, or I don't know how to meet people or make friends anymore. Think about people who have moved during this time, who are not only starting over, but they're starting over when things aren't completely normal yet. So there's a lot of anxiety that can come from kind of entering back into community again. So it's important to support one another, absolutely. So you can have anxiety and still be functional. This is really common. Okay, so first of all, we'll talk about what's normal in a little bit, but it's very common for people to have anxiety and still be able to get on with their day. Oftentimes it goes undetected or unrealized, and also because it looks different in kids and it can look different at different ages, people may not know that the underlying issue is anxiety because there might be some unexpected symptoms, which we will talk about. So what does anxiety look like? We're going to use a Winnie the Pooh example for just a moment. I don't know if you all have ever seen this, but if you Google it, you'll see, like if you Google Winnie the Pooh mental illness, you'll see that each character has been sort of assigned a mental health diagnosis, and it's kind of funny. I think it's really funny, actually. So the example for anxiety is Piglet. So you think about Piglet, kind of the way Piglet talks is like a little nervous and worried about things. So that's Piglet, but what you'll see is that there are physical, mental, and behavioral symptoms for anxiety. So physical symptoms might be sweating more than usual, restlessness or jitters, increased heart rate or blood pressure. And this is not just like in a moment, but you might actually find that people that have anxiety have prolonged issues with blood pressure and heart rate, nausea and headaches, diarrhea or digestive issues, insomnia, like we talked about. There's sort of a hyper-arousal where you notice everything and your body and brain are always looking for a threat, so it's really tough to sleep. And then muscle tension. So think about the way your body holds on to stress is usually by tensing up. And people don't even notice the ways that they're tensed. So there's a lot of work that we can do around muscle relaxation and just noticing where you're holding tension and loosening it that can actually help ease anxiety quite a bit. So the mental and psychological symptoms. Rumination. So rumination is just thinking about the same thing over and over and over and over again. Like you can't get a thought out of your head. Or even after you've let it go, it comes back later and you really can't stop thinking, oh, I'm worried about this. I must be sick. Or if I do this, I'm going to get sick. The same thing over and over again. Overthinking and overanalyzing, excessive worry, inability to make decisions, confusion, difficulty concentrating, racing thoughts, impatience and irritability, which that's very common because if you're already on edge, then anything can set you off. And then vivid dreams or nightmares can come with that as well. And then behavioral compulsions. We talked about with OCD, there are compulsions, things that people do to ease anxiety that actually don't ease anxiety. In fact, those things typically feed anxiety a lot more because they're just listening to what anxiety needs rather than finding an antidote for it. Avoidance of triggering situations, and then, of course, high distress and triggering situations. So we talked about in the trauma session, I'm not going to go over this in too much detail, but remember that every response to a threat or trauma or anxiety is a fight, flight, or freeze response. So your system is either trying to fight it, so like we said, overanalyzing or irritability or tantruming in kids. Fighting it is avoiding situations or withdrawing, and then freezing might be kind of freezing on tasks or having regressions in skills that you once used to be able to do and now you can't because your body's in survival mode. So that's generally what anxiety can look like. Now, I will say in kids it can look a lot different. I've done a whole session on this before, anxiety in kids. Kids generally show more behavioral symptoms than any of the others. And that's because they're still developing. They don't often have the language to be able to express what's going on in their bodies because they also may not really understand what's happening in their brains and bodies. And so with kids, you see a lot more tantruming and acting out and irritability. They might say things that are really surprising, like, I hate you, which they really don't hate you. They're frustrated by the situation or they're feeling unsafe in some way, and so kids tend to act out more than experience the others. They also show a lot of physical symptoms. So a lot of kids will have no other symptom but nausea and diarrhea, and it'll be like that for a long time, and people will bring them in, and we'll find out that what's underneath it all is anxiety. So there's some things that are surprising and maybe unexpected that are worth taking a look at and investigating if you're seeing them come up a lot. All right, so what is normal? So everybody to some extent has some anxiety. That is, we just have it, okay? It's a protective thing. It's your body's way of making sure that you are watching out for the details that need to be watched out for. So some level of anxiety or concern is normal. There's also a difference between stress and anxiety. So people are like, oh, well, I'm not, I am really stressed, and is that the same thing? They're not the same thing. So stress, there's typically a very clear trigger or something that's causing the stress. And then once that has gone away, then so does the anxiety. Does that make sense? So if you have a big work project that, it's a couple months that you're working on it, you can feel stressed about it. But then once the project is submitted, then you feel relief. With anxiety, even if the triggers are gone, you may still feel restlessness, you may still feel agitated, you may still have that just general feeling of being concerned about something, and maybe you don't know what, it lingers. And that's the difference between stress and anxiety. And so the questions that you can ask yourself about whether or not this is anxiety to be concerned about: are you feeling more anxious than not, generally, on any given day or any given week or any given month? Are you noticing it impact your functioning? So are you suddenly avoiding situations that you maybe didn't before? Are you unable to do daily things because your body and your system is overwhelmed and your mind is overwhelmed? Are you struggling to find ways to cope with it? And that's how you know it may be time to look for some help. So if we feel this anxiety and it goes unchecked, a number of things can happen. One, our bodies will continue to stay in stress mode. And then long term, we've talked about what that can look like. Weak immune system increases your risk for depression, and we'll talk about the link between anxiety and depression later. And then it increases your risk of heart disease, high cholesterol, a lot of physical symptoms as well. And in general, again, the functioning. It's going to affect the way that you relate to other people. It's going to affect the way that you get through your daily life. So we want to make sure that we nip it in the bud when you notice these symptoms happen. All right, so now we're going to switch to the other Winnie the Pooh character, Eeyore. So depression is pretty well characterized by Eeyore. You notice that he's slow moving. He's pretty down when he talks. He's even blue. That's depression, okay? The thing about depression that people don't always realize is just like anxiety is not always just a feeling. Well, depression is not always just feeling sad. Depression is more than just sadness. Okay, so it can be mild or severe. It can impact your functioning, but what's important to figure out is if it's persistent in its symptoms. So there's the list there of some of the symptoms you might find with depression: depressed mood, loss of interest in activities of daily life, or things that you used to like and then suddenly those don't bring you joy anymore or pleasure anymore, feeling worthless or guilty, a loss of motivation, a loss of hope, difficulty thinking, concentrating, making decisions, thoughts of death and suicide, and then physical symptoms. With depression, the physical symptoms look a lot like a lack of energy, overly sleepy, or at the other opposite end of the spectrum is really struggling to sleep, and it can actually be both. Like you can both want to sleep for a long time and not really be able to get any restful sleep. That's a lot what depression looks like. Physical pain, a loss of appetite or an significant increase in appetite, significant weight loss and weight gain without meaning to is very common with that. Irritability and slowness in activity. The one thing that I always add is that for men, depression often manifests itself through anger. And this is just very common. So you'll see men who are depressed really struggle with impulse control and anger. And this is not everybody, but it's common for that to be the case. And so a lot of times people are doing anger management work when they really should be doing more depression work. And they're just not noticing that's what it is. Depression is highest among the ages of 18 and 25, actually. And just like we talked about before, 35% of people that have depression don't ever get treated, even though it is treatable. Overall, it affects about 7.3% of adults in the United States. Again, another really big number. 7.3. And again, so look at this list of symptoms. Notice the connection between mind and body. This has been a thread through every single thing that we've talked about, is that the mind is always communicating with the body and the body is always communicating with the mind. They reflect one another, and what's beautiful about that, even though it's hard, is that we can use our bodies to tell us what's going on in our minds. Having kind of a physical symptom is a really great way of noticing, like, something is off in my brain potentially, and I need to figure out what it is that's coming out. Okay. Now, we talked about grief before, and I explained that grief and depression are not the same, but what we do want to notice is whether your grief is turning into depression. That way you can get treated for that as well. So you can see that with depression, you have persistent sadness and depressed mood for at least 2 weeks. That's like the official diagnosis says it needs to be for at least 2 weeks. And it might be recurring, but it has to be 2 weeks of that. And almost always with depression, there is either a change in self-esteem or self-worth or self-image in some way. With grief, the sadness typically comes in waves. It may not be a persistent feeling of sadness for a certain amount of time. It typically comes in waves, not always. Sometimes you may just feel that way for a month or several months or whatever it is. Usually there are memories and thoughts of loss, so they're more specific thoughts rather than a general feeling of depression. And then with grief, there's usually no loss of self-esteem. So that's a pretty big marker. It's like, how do I feel about myself? Am I sad because of this loss, and am I grieving, or is it changing the way that I look at myself? So that's kind of a sign. The two can happen at the same time. You can be grieving and have depression. You can also just be grieving. You can also just have depression. Usually depression, or the depression can be caused by the grief, but they are not the same thing. So when you're thinking about whether or not you are grieving or have depression, you can think about where is your hope? Like, do you have hope? And typically people who are grieving still have hope. People with depression are struggling with hopefulness, and then that self-worth status. All right, so now the relationship between anxiety and depression. So people, when they talk about them, they often go hand in hand. People are like, oh, I struggle with anxiety and depression. Or medications will often be medications for anxiety and depression, and the dosage will just be a little different. There are some that are separate, but there's a lot of overlap between them. And so as you can see, we've talked about with anxiety, there's a perceived sense of danger, uncontrollable worry, feelings of helplessness. And then with depression, feelings of hopelessness, worthlessness, lack of hope for the future, lack of motivation. And then there's an overlap. So that rumination that we talked about, that broken record in your brain where you're thinking the same thing over and over again, that is common for both anxiety and depression. You might have difficulty concentrating with both because, again, either you don't have the energy to think through things or you're hypervigilant and you can't stop thinking about the one thing that you're worried about versus everything else. Changes in sleep patterns happen for both. Physical symptoms happen for both. The reason there's a relationship between the two of them is because the thoughts of anxiety and depression have the same negative roots. And so you can trace them back and really find the same root to the thoughts that you have, whether you have anxiety or depression. So one thing that I encourage people to do is to write down these thoughts that you're having over and over and over again. So write them down, make sure that you can see them, and then with every single thought that you have, write some sort of challenging statement to go next to it. So we're not trying to dismiss your feeling, but we are trying to get your brain, like we talked about before, instead of being stuck in this emotion part of the brain, to then be able to make a connection to access the parts of your brain that actually help you problem solve and deal with what's happening. And so we're challenging this so that there's more balance and more communication between these two parts of the brain. So, writing it down is really good because you're naming it, but then challenging it with something a little bit more logical or a truth that you know. I like to encourage people to incorporate scripture. So look up scriptures about anxiety, look up scriptures about depression, whatever emotion you're feeling. If you Google scripture about grief, I mean, it's just as easy. You'll get a whole list of them. And obviously we want to make sure we're reading it in context, but the word is fruitful regardless when you use it. So, the other thing that you can do with anxiety is set a worry time. So when you have this tendency, and this could be even for depression, so this broken record, set a broken record time. Say, okay, from 10:10 to 10:20, I'm going to let myself think whatever I need to think, and then you're going to work on trying to reduce that time and make it smaller. Because what happens is when you allow your anxious thoughts to run, they're just going to grow and grow and grow. So we want to give them space so we can acknowledge what's happening, but we also want to set a boundary around them because we know that anxiety grows when there are no boundaries. So that's just a couple things that you can try. Okay. Has anybody heard of the term languishing before? Okay. So there was an article in the New York Times, and that's the title right there. And it's on languishing, and it's a very fascinating article because it was talking about how anxiety and depression were the prominent feelings of the year 2020, and then 2021 can be characterized by languishing. And I find this really interesting because it's giving new language to a feeling that maybe a lot of people have not been able to put a name to. So there's a little picture there that will tell you a little bit more about languishing, but in general, languishing is not the same as depression. So they're talking about how a lot of people during this period, especially this year, kind of after COVID, trying to recover from COVID, aren't hopeless, but you're still feeling very, very blah or meh, or it's the opposite of flourishing. And so you can see there, it's kind of an aimlessness, a joylessness, not a lot of motivation and drive. It's just a very a feeling of kind of being on a plateau and not flourishing and growing. So another article that I read about it said that it was a restless state of feeling unsettled. So it's kind of a weird in-between feeling that there's no diagnosis for. Like we can't look at that and say that's definitely depression because it doesn't meet criteria, but it also doesn't meet criteria for anxiety or anything else. So why does it matter to us if this is not clinically diagnosable or if we can't put a name except for languishing to it? Well, it's because research says that the people who are the most likely to develop PTSD or a depressive diagnosis in the next decade are not people who are experiencing those symptoms now, but people who are languishing right now. So people who are in this state right now, if it goes unchecked, are more likely than in the next 10 years to develop a clinical diagnosis. And think about it like this, if you go too long without feeling a sense of motivation or you're not flourishing, then your brain is going to start responding and start becoming more depressed. And so it's important that we put some language to it. And I like this, even if it's kind of a weird word in the article. They say, instead of telling people that you're fine, you just say, I'm languishing. I'm probably never going to say that, to be honest with you, but I like that you can be able to say, like, this is the state that I'm in that feels really bizarre, and we can help pull each other out of it, or there's things that we can do. And so a couple of the things that you can, well, you know what, I think I'll talk about in the next one anyway. But I also talk about, during this time, there's been such a very bizarre contradiction of emotions. And so I know that for a lot of people, and this is how I would describe myself, especially when we were really in the thick of COVID, I was both overwhelmed and bored all at the same time. It's just kind of like there's so much to process. And then if you're a parent, there's kids that you're taking care of. You can't take them anywhere. You can't do anything. You're trying to figure out like how to keep yourself safe, your family safe, what's happening in the world. And at the same time, it feels like there's like nothing really to do. You're just here. And it's almost like a boredom. Like there's no actual stimulation because you're not flourishing. So I think it's really important to acknowledge that there can be a contradiction in the emotions that you feel, and you can feel two things at once. That's why there's a word called bittersweet. Something can feel bitter and sweet at the same time. I think that we have this tendency to want to put everything in one specific category without realizing that we are complex people and we can feel a lot of things all at once. And so that's just really important to notice. And so if you're languishing, that's normal, and it's good to be able to identify it as that so you can work on different ways that you can get yourself out of that place and hopefully prevent any sort of diagnosis in the future. Okay, so now we're going to talk about buffering anxiety and depression. We had talked about buffering trauma in the beginning, and I had mentioned that the things that I have here are both preventative and they're healing. So you can work on these things as setting a foundation for yourself and your family. And then afterwards, if you experience something really difficult, again, focusing on these things will help you heal. And so The very first thing, has anyone heard of attachment theory before? Okay, so I would encourage you all to read about this as well. It's really interesting. As therapists, we learn a lot about attachment theory because what we've learned is that this is the core of everything. Healthy attachment is the secure bond that a person feels with their caregiver. So the most significant time of attachment development is from birth to age 4, but then whatever happens during that time extends to the rest of your life. So in adulthood, the way that you have attached or maybe not attached in a healthy way to your parents affects your marriage, affects your friendships, affects the way that you attach to different people. So it's really important, whether you're in crisis or not, hopefully before crisis, that you are working on attachment in your life. With the little kids in your life that you're doing that, you're attaching well to your kids, or working on at least processing through the attachments that you had with your caregivers. Attunement, so attachment is a secure bond. Attunement is how you actually achieve having a secure bond. So attunement is being present, tuning into the emotions of the person that you're with or with your child, kind of being able to be really present with their thoughts and assessing their needs. So this little triangle that you can see is an example of what it looks like to have a healthy attachment. So these are the things necessary to have a healthy attachment. To feel safe from harm, to feel that your caregivers are keeping you safe from harm, that they're able to soothe you when you're hurting, that you feel secure in the world, and then seen by caregivers. Okay, so I talked before about how I love the description of God in the Old Testament as the God who sees. These are all things that God does for us. So because he's perfect, hypothetically, we should have like perfect attachment with God. That, doesn't always happen for a number of reasons, but we also are working to have these attachments with the people that love us. So attachment requires feeling safe, soothed, secure, and seen. So remember those 4 S's. During a time of crisis, and when a child is just struggling with anxiety, or when a person is struggling with anxiety, it's important to provide more comfort, more nurturance, and more attention. And so a lot of people will say, well, I don't want to spoil my kid. Like, I need them to be tough and have, thick skin. Which those things are important, but think about the way that God deals with us in our pain. And it's never by telling us just to get thicker skin. He always gives us hope, but he always comforts first. And so the only way that you can really spoil a child or spoil a person is by doing something for them that they can do for themselves. So think about that. Are you doing something for them that they can do for themselves? Then maybe you're spoiling. But if you're providing a comfort that they cannot provide for themselves, or a sense of security that they cannot get on their own, what you're doing is actually nourishing their development and creating a healthy bond. And so making sure that you're focusing on that will stave off depression, stave off anxiety, and again, heal all of those things as well. I also wrote creating healthy boundaries. So I spoke before about how anxiety grows when there's a lack of boundaries. And there's boundaries with everything. There's boundaries with information. There's boundaries with other people. There's boundaries in our marriages. There are boundaries with our kids, with our work. All of those things are worth exploring. I don't know if I put it on your resource packet, but there's a book called Boundaries, and it's by Dr. Cloud and Dr. Townsend, and it is like the go-to book on boundaries. It's a really good overview of why it's important to have boundaries, and it's biblically based. So it'll talk about all the places in Scripture that God asks us to have boundaries and what that's supposed to look like, and then what to do when people don't respect our boundaries, et cetera, et cetera. It's a beautiful book. So creating healthy boundaries will also stave off anxiety and depression. We talked about this before, but naming emotions and losses, actually being able to name them specifically, is a really helpful way to actually process things and keep things from festering and growing inside of us. So I encourage that as well. So meaning and flow. So this is more towards the depression side of things or the languishing side of things. So we kind of talked about how it's like that blah sort of feeling where you can't get motivated. You're not really having the energy to do what you need to do. And so the article, the article on languishing talks about how you can increase your motivation by finding a meaningful task to do. The same thing goes for depression. So I think maybe it's on a different slide. I'll talk about it later. But what you can do is you can find a project to do. And it could be a very simple project, and maybe it's not a project, maybe it's just a task. Particularly if you have any sort of lack of motivation, find a goal that you can set that's achievable. Because actually when you're able to master something, even if it's a very simple thing, it actually activates and wakes up your brain and increases your motivation. So they talk about getting into a state of focus and absorption into a meaningful task can help get you out of languishing. And if you're struggling to focus because you're feeling anxious or because you're just languishing and that's what happens, then you can split it up into sections. So try your best to do it for 10 minutes and then take a break. Or if you all have ever heard of like a Pomodoro timer, it'll have you do something for 20 minutes and then take a 5-minute break or a 10-minute break. That actually it stimulates the brain in a really healthy way, and it gives it a reset during the break time where you're able to actually get back into it and continue your flow of work afterwards. So that's worth looking into. And then, of course, we're in a season of Thanksgiving now. We're getting to Thanksgiving really soon. And I didn't put a slide on this, and typically I talk a lot about gratitude, but this is one of the biggest buffers for anxiety. And so there's been quite a bit of research to show that gratitude can offset anxiety pretty significantly. They did some brain scans, and what they actually found is that anxiety and gratitude can't be activated in the brain at the same time. And that's because they use different parts of the brain. So you can't be anxious and be giving thanks at the same time, which is really cool, actually. And so the more you have a gratitude practice and develop a gratitude practice, the less anxiety has space to fester. And so I always encourage having a gratitude journal or having some kind of regular gratitude practice that you can use to help you work through it. One of my favorite verses is Philippians 4:6-7. And it's what I say is like a prescription for anxiety. It says, "Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus." Do you see that? It says, do not be anxious, but knowing that we're going to be anxious, they say, instead present your requests to God with thanksgiving, and God will give us peace that doesn't make any sense. I love that. And then finally, brothers and sisters, whatever is true, whatever is noble, whatever is right, whatever is pure, lovely, admirable, if anything is excellent or praiseworthy, think about such things. Whatever you have learned or received or heard from me, seen in me, put into practice, and the God of peace will be with you. So this is so great. What we know is that gratitude floods the brain with dopamine, which dopamine is the pleasure hormone. And so the more you have gratitude, the more it replaces all of these chemicals that are actually increasing your anxiety and depression. It's really cool. I love it because this is like scripture, like science finally caught up to scripture. Okay, just a few other things that I'll add about coping and different things that you can do to deal with anxiety and depression. In general, you can think about it this way. If you are struggling with anxiety, your goal is to calm and soothe your system. If you are struggling with depression, it's the opposite. Your goal is to stimulate your system. And so you, as I said with depression, you can start with small goals and master them, because mastering tasks actually reduces distorted thinking and worthlessness. And so it can be as simple, especially people who are really deep in depression. I even say, like, your goal is to take a shower in the morning, a 5-minute shower. Because that can be an incredibly difficult task for someone who's severely depressed, even the most basic things. So even if you're a little bit depressed, think about one small thing that you can do and try to master it consistently for 2 weeks, and then add another goal to what you're doing. So that's stimulating your system. We've talked about with trauma and anxiety, they're the same in the brain, is that they either go backwards or forwards. So they're either thinking about what has already happened and ruminating on that, or you're concerned about the future and what could happen. And so doing any kind of grounding exercise, we talked about that in the trauma section, any way to ground your body and your brain into the present is a way that you can reduce anxiety. And so you all look up the 5-4-3-2-1 exercise, if you look up grounding techniques or any sort of breathing technique, all of those things are ways to get the brain realizing that you're in the present moment and you're safe and you're not actually threatened by what you're afraid of or what you've been through. So that's something you can do for anxiety. This is for both anxiety and depression. You can make a senses list. So make a list, make the categories sight, sound, smell, taste, and touch. If you're struggling with anxiety, write 10 things in each category that make you feel calm. And I know 10 might be a hard number to come up with in each category, but you got to make yourself do it. And then the same for depression. If you're struggling with depression, make a senses list, write down 10 things in each category that bring you joy or bring you energy. And if nothing's bringing you energy right now, think about what it was like before you struggled with depression, or if there was a time in your life where you had clarity on something that gave you energy. And so, and then use that list to actually help you do the things that are on there. The more we use our senses to ground our bodies, actually the better our brains respond. We talked about the connection between the mind and the body. This is a beautiful way to actually use your body to heal your brain. Being in nature, there's a lot of research on actually being in nature and how much that improves mental health symptoms. There were some studies that showed that people who exercise outside versus in a gym actually have better mental health outcomes, which is really interesting. We've talked about journaling. And then, of course, counseling. If you need somebody to talk to or the things that you're trying are not working, then it might be time to explore some different things. There's a lot of reasons why you might be anxious and depressed. Some of it might stem from childhood. Some of it might stem from your old experiences, and those things are worth exploring with somebody that can help you make sense of them. And then, of course, if it's warranted, medication is really helpful and can be really important. We talked about how sometimes this anxiety and depression, there are chemical imbalances that happen in your brain, or the way that your brain is processing things, it actually needs to be altered in some way that can only be done from the inside out. And so not everybody needs medication, but if your doctor tells you that it's worth looking into, I think that it is a good and healthy thing to use your medication to be able to help your brain. I think there's a lot of people who, Pastor Chad and I were talking about this earlier. If you go to the doctor and you're sick with some sort of illness, and the doctor is like, oh, well, I can give you this blood pressure medication, or I can give you this for your diabetes. We're like, oh yeah, I'm gonna take that. That's gonna help me. And there's a reluctance to take medication for things that will help your brain, even though your brain is just as much a part of your body as everything else. And we should even emphasize the fact that without your brain, you can't do anything else. So it's okay to explore medication and talk through the risks and benefits with your doctor, but this is something that the stigma should not keep you from being able to explore it if it's something that you feel like you might benefit from. Okay. One more. I think we're good. Thanks. Okay, and then finally, these are just a couple of the verses that I want to leave you all just with some hope. So John 10:10 says that the thief comes only to steal, kill, and destroy. I have come that they may have life and have it to the full, or some translations say have it in abundance. And I love that because, you know, if you go around and talk to anybody about what they've lost during the season of COVID, it's not just people, but it's been a lot that's been stolen from us. It's been a sense of security, a sense of community, the ability to celebrate things. Those things have been stolen, but Christ wants us to know that though these things are stolen and the enemy wants to continue to make us feel like he's going to continue stealing those things from us, that there's hope, and Jesus came to give us an abundant life. So this is hard because that means that our joy is not based on our circumstances, but based on the hope that we have given to us on the cross. That can be a really hard place to be. So I encourage you to talk through that with people, what it looks like to have joy even though our circumstances may not be joyful, and then how you can encourage one another in that and remind each other with gratitude about the hope that's in your life. And then finally, just a last encouragement, John 16:33 that says, I have said these things to you that in me you may have peace. In the world you will have tribulation, but take heart, I have overcome the world.